Our hospice volunteer program is set up to help the caregiver. If the caregiver needs a break or if they have a doctor's appointment, whatever the case may be, that volunteer has the opportunity to come in and sit with the patient, just kind of helping, taking care of them. A lot of times people end up reading to them, or sometimes they have baked goods that they bring in. We want to make sure that that caregiver has the opportunity to continue kind of leading as much of a normal life as they can. Our hospice is actually designed to serve not just Henderson County, which is the primary, but also Warren County and Mercer County as well. Well, I think a lot of misconceptions are, am I going to be trained enough? Will I be able to actually sit and take care of the patient? Really, what you're doing is you're providing that exception of being able to stay there with the patient while the caregiver may need a break. One thing that we've done, we have a very good hospice volunteer program. So that provides training for the volunteer. We have a chaplain that comes in, we have my nurse that comes in, and they do a tremendous job going through kind of what they're going to see, what they might come into. Besides the medical aspect, there's also the spiritual aspect. Not only does it take you through whatever the patient's going through, but also what the caregiver might be going through as well. It's an 8-hour class, but it's a very good class, just so they have a better idea of what's gonna happen. Actually is a good confidence builder, and it helps the hospice volunteer to be able to take care of the patient. This program is kind of vital. It is vital to our hospice program. It allows people to come in and help. In Henderson County, we have volunteers doing a lot of things. When we set up a patient on hospice services, we also make available to them this volunteer program as well. Our volunteers have to go through not only just the training, but also they do a background check, just so that they know that the quality of person that's going to be coming into their home is above notch. This is another example of what it is like for our county to be able to have this type of service. If you've ever volunteered for anything, it's a very good feeling, and we are so grateful for the volunteers that we have, even outside of the hospice program. But for people to know that they're going to be helping someone that is in the dying process to make them comfortable, it's pretty awesome. And we really encourage people to please do this. It's a tremendous feeling when you make them feel better just by being there. We have nurses that have a lot of years of experience in our community. They just provide the greatest care, and we're very lucky to have them. We also have wonderful CNAs, home health aides, that also partake in the plan of care for that patient. So everything that we do is based on what the physician wants us to do. One thing that is fantastic is we also have therapies that can come into the home. Physical therapy, occupational speech therapy. And again, everything is ran through the plan of care, through the physician, so that they are totally up to speed of what is going to be happening with their patient. What news could be worse than getting that you have the diagnosis? And by hospice, the terminology is 6 months or less of living. That doesn't always hold true, but what that means is that we're going to immediately start and take care of the patient and the family, the caregivers as well. So we want to make sure that that patient is comfortable with what we're doing. So our hospice nurse comes to the home, and she step by step goes through what is going to happen. We also want to make sure that it's a matter not so much of quantity of life, but of quality of life. So we want to make sure that the patient receives that care, and above everything else has the dignity that they deserve towards the end of life. Just knowing that we have not only taken care of the patient and given them the best possible care, but also the reward of knowing that the patient's caregivers are also taken care of. When the patient's family says, "Thank you so much, we couldn't have done this without you," they truly mean that. And that is just that's the best feeling possible. That is definitely an emotional time. We have what's called an interdisciplinary group, and we meet every 2 weeks. And what this group does is we not only talk about the physical health of what's going on with the patient, as part of our interdisciplinary group, we meet the social aspect, the spiritual aspect. So we're able to, when we have this meeting, we include the chaplain, the social worker, and we review kind of what's been going on with the patient, not only just medically, but also the social aspect, the spiritual aspect. So we're able to, when we include the chaplain, the social worker, they hear from our team, which consists of the nurses, the home health aides, our chaplain, our physician, our hospice physician. So we're able to kind of tell each other what's going on, and it's a very good discussion to have. But also we tell them what's going on with the patient, what's going on with the caregivers. They want to know too, what do they need? What can we possibly provide for them that's going to help them get through this? It's very nice that we have that kind of camaraderie, and the physician and of course the team inside the health department, our nurses and our bath aides. We are here for them even after the loved one is passed. We have our team that also provides that care. Besides the booklets and such that we have, we also contact them. So we contact the caregivers even after a year after the patient's passed, just to kind of check in on them, make sure that they're doing okay. If there's anything that we can do for them, we have a lot of resources for them as well. So our care doesn't just stop after the patient's passed. We want to keep that going. We want to make that caregiver feel that they still have the support from our hospice team.